Afternoon, everyone. Hope everyone's having a good day. Whether it's snowing outside, I was able to I I've been working out, doing a lot of more cardio lately because I'm due for my next vaccine. And I'm just trying to boost my I'm due for my vaccine in next week. So I am planning to boost my immune system very well prior to my second dose, because I've heard and I've read that there's a percentage, not a large percentage, not like 50%. There's a percentage of people who have where the symptoms of COVID, fever, chills, body aches, these symptoms of COVID, fever, like slight fever, or things that may be close to fever but it doesn't meet the criteria for fever because of like the degrees, like it may be like 99 as opposed to like 100 or some shit. I've seen shit like that. So who've received like, you know, more severe symptoms based off of COVID. So I'm just trying to boost my shit as much as I can. This is going to be on COVID in general. I want to say shout out to New Zealand, shout out to Asia, shout out to the countries who actually did take this seriously like they should have originally, and who flattened the curve in their countries and prevented less deaths. This is a shout out to Wuhan. This is a shout out to China. This is a shout out to New Zealand and many other countries who I may not be aware of who flattened the curve. Since the beginning of COVID, one of the iterations were there has to be global collaboration, because if there isn't global collaboration, COVID exploits your weakness. And if you're not all engaging in the same forms of risk aversion or the same levels of risk aversion, then COVID is going to spread and it's going to kill people. This has been the line of thinking for COVID since the beginning. It has not changed. What did you see the Western world do? You saw many medical professionals, a majority of them. I'm gonna say a majority of them. Oh, actually, I'm gonna say the ones who have the power to do shit. The epidemiologists who may be head epidemiologists, head virologists, whatever there is for your hospital, for your state rep, all of these things. When it came to the people in the West, they decided to not take it as seriously as other countries, and started doubting countries who've dealt with things similar to this, even though COVID is unique in itself and is different from everything else, you know, who've dealt with something like SARS or MERS, or, you know, any respiratory virus or any epidemic, like, you know, that had China, where all those people were wearing masks. All of the information and much of the predictive and preventative actions that they could have engaged in, they didn't do it because they thought they were better. They thought they knew it. There was a degree of, I'm going to say, xenophobia and racism that contributed to lack of actions taken to flatten the curve. Levels of accountability are on all people in leadership of hospitals, government, who did not push hard enough for things to be done. Fauci, there was blood on his hands. Birx, there's blood on her hands. The only justifications that these people will be able to have regarding COVID is that, hey, you know, as a president of the United States, as opposed to my role, the level of accountability more hangs on to Trump. But with those people, there is still a degree of accountability in which they are complicit in people dying. They're part of the system. When they have the opportunity to speak out greatly, they didn't. Based off of some things. Some got death threats, some didn't, because they spoke a little bit differently, but both didn't agree with Trump. So it doesn't matter, you're still a part of it. When it came to the mask problems earlier in the United States, there were ideas of double masks. There weren't clear messages of what type of mask, like N95 mask or shit. Then more information came in because they think people are fucking dumb and can't read. Well, we want the public to wear N95 masks because the public doesn't have access to We want them to wear any type of mask because so when other countries were wearing masks, Asian countries and New Zealand countries were wearing masks, we weren't. Academia or the medical field in America, for some reason, was still stuck on do they wear masks or do they not? When Asian medical professionals, the Asian community was screaming, listen to me, screaming, you do need a mask. You do need masks. There was tons of literature regarding out there that is proven to be effective regarding the type of droplets that can be prevented from certain type of masks and the effectiveness of certain masks, a gaiter versus a surgical mask versus a bandana versus a N95 mask, which changed from like a KN95 masks to a valve mask that's N95 through an unvalve. There was so much literature showing that we had enough information to determine that we should wear masks earlier, and America didn't do it. New Zealand, I'm not sure about the mask for New Zealand, but I want to go to, so that is, these were examples of, there's a difference in what the Eastern world did, Asian countries who have now been demonized, who are still demonized, and you got doctors coming out saying Wuhan was that the virus was made in a lab. Hey, it's xenophobia, okay? Just want people to know it wasn't made in a lab. This is how viruses develop. When it came to even the mask or just information in general, there wasn't a clear message, and that is because academia in the Western world wanted to stay by themselves. Now, New Zealand and Asia, their lockdowns were complete lockdowns. Complete lockdowns. Not partial in the country, they were complete lockdowns. Okay? No one come in, no one go out. If there were some places in China, they were beating the shit out of people, which I'm fine with. I guess to summarize this difference between New Zealand, America, and New Zealand, China, and America, is that you saw with Asian countries and New Zealand that they didn't take risks giving people the idea to choose, and they made the choice for them, and they reinforced the reality that they must follow instructions. And that was the difference between flattening the curve and not flattening the curve. When you give people too much ability to choose when they're fucking dumb, this is what leads to that. Wuhan is now open. Why? Because they followed instructions earlier. I don't give a fuck if it's your rights. Your rights they don't impact you. They kill other people. So the difference in New Zealand, Asian countries, and the United States is that they paid attention to science early, and they were willing to collaborate with other people, and America wasn't. Their leadership, the doctors who work for little departments or little hospitals, they didn't do enough either, because they were spreading out information like, oh, only wear a surgical mask. There were many hospitals that had their staff wearing surgical masks when the clinical staff was wearing N95 masks in the same work environment. I mean ER, but you're like a transporter, so you only get a surgical mask. That's what I mean. This is how bad it was in certain parts of the country. And it was disgusting. And what was it based off of? America being lax, America thinking that they can do things on behalf and let the public suffer, while they don't acknowledge that they've made mistakes, or that they made mistakes early. When you had that whistleblower, when he was told that what was it? I forgot what it was. It wasn't the CDC. Some organization, they had other things to do. So in terms of having a pandemic response team that's on the back burner, understanding that they're gonna have a lack of PPE, all of these things are based off of the idea, the delusions of grandeur of the medical community in the United States. So one thing that I decided to do way before everybody even did, while everybody was demonizing Asian countries, I was paying attention to them. The World Health Organization was paying attention to them too. This is why the World Health Organization decided to use some of the things done from these Asian countries and implement it and recommend it to other countries, which Donald Trump said they were being held captive. But again, xenophobia, again, China flu. To this day, you're still seeing evidence of people having problems with Asian people and assuming that they're gonna spread COVID. The Asian community in America has suffered a lot. Many poor Asian people have suffered because of racism, xenophobia, assumptions that they have fucking COVID, they're gonna fucking infect everybody. Chinatown and many parts of the country have been negatively impacted. Koreatown, just Asian little towns where there are lower income Asian people, they've been impacted the worst, very badly. And I've tried to make an effort to help them. I've donated. I did an Asian Lives Matter, spent about $400 at that protest, did all these things. But I was well aware of making sure that I got the accurate information from people who actually have evidence of the yielding results, and that was the Eastern world, Asia. So basically this video is just to point out is to set some differences between the cases in the United States, the Western world and the Eastern world, and look at the results of science. Look at New Zealand, look at Asian countries, look at China, and see who's the winner. So who's the moron? Who are the bad people? Is it Wuhan? Is it China? Is it Asia? Or is it the people who are full of themselves in the Western world? Like, comment, subscribe. Again, shout out. Oh, and I recommend Asian Boss. Asian Boss was one of the first channels that I used in order to get information in terms of video wise, outside of translating the literature from Asia and sending it over. So I advise Asian Boss. There are a bunch of interviews by medical professionals, and you should check that out as well. Like, comment, subscribe. Love you all. GG.